Dr. Mark Agresti. Hi. Visit my website at drmarkagresti.com for my blog, which I post on regularly. I want to talk about intractable hiccups. Why is the psychiatrist talking about intractable hiccups? Because that's who treats intractable hiccups. If you're having hiccups, 40% of people respond to very passive treatment. Hold your breath, drink cold water, a Valsalva, which is holding your nose, closing your mouth, and breathing out, like popping your ears, grabbing your tongue and pressing hard on it and pulling it out just a little bit stimulates the glossopharyngeal nerve. The other ones are vagal resets, the vagal nerve. Drinking vinegar with lemon. These are the passive ways. 40 to 60% of people respond to intractable hiccups with that treatment. So that's not bad. Now, what is the mainstay treatment? The mainstay treatment is an antipsychotic, believe it or not, called Thorazine, chlor, 25 to 50 milligrams. If you're not psychotic and you take that, it really, you could feel sedated and drugged for 24 hours. That's the problem with that. But it has about an 60 to 80% effectiveness. Maybe it's worth it. There's a drug called Reglan, Metaclopramideand. 10 milligrams of that works fine. It's another antipsychotic. All these drugs block D2, dopamine, the D2 dopamine receptor. The other one is Haldol, 2 to 5 milligrams, knocks intractable hiccups out. If this doesn't work, the second line treatment would be baclofen, which is a GABA drug. 10 milligrams knocks out the hiccups, or gabapentin Neurontin. If that doesn't work, people go to Depakote or Tegretol, which is valproic acid, or carbamazepine. And if that doesn't work, people use amitriptyline, Nefedipine. And if that doesn't work, you get an anesthesiologist who starts an IV drip and uses IV lidocaine. And that will definitely work, basically trying to calm down or numb the vagus nerve to stop this intractable hiccup. But it's an interesting story, I thought. That's why I made a video on why psychiatrists got involved, because the treatment turned out to be antipsychotics. Hopefully that helps if you have intractable hiccups.